you're never too young to be menopausal. So it's always something, if you think you've got some symptoms in irregular periods, always consider menopause. So the youngest person that we see in our specialist menopause clinic is currently 14. So I think that just demonstrates that you're never too young. Equally, some people are put into menopause by some of the treatments for cancer. And again, they can be young as well. So you're never too young to be menopausal. So always think menopause if you think you've got the symptoms. Don't be fobbed off by someone saying you're too young. And the answer is no, unless you're under the age of 40. Otherwise, we do blood tests that fluctuate wildly and you get results. You've got hot flushes, night sweats, and not had a period for 6 weeks. You do a blood test and it comes back normal, but you've obviously got menopausal symptoms. So we don't suggest using blood tests generally to diagnose, because they give either a false reassurance or they can be used for someone to tell you that it's normal and you don't need to have any treatment. So they're not particularly useful. And again, that's wrong. You can take HRT to manage your symptoms for as long as you need to. And we suggest having a yearly review if you are on HRT, looking at your symptoms, looking at where you are in the menopause, and also looking at if anything else has changed in your medical care. If you are happy on HRT, then you can carry on taking HRT for as long as you need to, having a yearly review and then assessing the risks and benefits as you go. And again, this is wrong. There is HRT around called sequential HRT, which is giving you estrogen all the time and then progestogen on top for 12 to 14 days a month, which mimics the menstrual cycle. And it's for use when people are still having periods, even if they're irregular periods. It doesn't delay anything. If you took HRT for 5 years and you still had symptoms when you stopped it after 5 years, you would have been having those symptoms anyway. It doesn't push the symptoms along. And some people will have symptoms for 5 years, for 7 years, for 10, for 15 years. If you were someone that was going to have symptoms for maybe 3 years and you took HRT for 5 years and stopped, you wouldn't necessarily get symptoms when you stopped taking it. HRT does give an increased risk of breast cancer if using a combined treatment for longer than 5 years over the age of 50. The background risk of breast cancer is an extra 24 cases per 1,000 women. And if you use combined HRT, so that's estrogen and progestogen, for 5 years, there's an additional 4 cases of breast cancer. However, if you look at something like alcohol, if you drink more than 2 units of alcohol a day, then you have an increased risk of 5 breast cancer. And if your body mass index is over 30, then you have an additional 23 breast cancers related to the weight. You can negate some of that by doing 2.5 hours of moderate exercise a week, which gives you less breast cancer. So breast cancer risks are all relative and need to be looked at in the context of the individual person. And in fact, we have less evidence and less rigorous trials around herbs because they're sold as a food supplement rather than being sold as a medication. So they do work for some people, and NICE have got their menopause guideline and they do recommend red clover and black cohosh in there. They were the two that had the most evidence for sorting out menopausal hot flushes and night sweats. However, they're not safe to use with some medications. So if you have breast cancer, they wouldn't be safe to use with some of the breast cancer treatments. So you do have to treat them, if you're going to use them to treat menopausal symptoms, as a medication, and go and seek help from a pharmacist or a professional to look at your other medications and make sure there's no interactions there.